to go in there on that final day to find out whether it's worked or not, and the doctor to have a big smile on his face and say you're free of hepatitis. That's just so much more weight off your shoulders. Like I said, it's a second throw at life to me.
When the announcement was made on the 15th of December 2015 that these drugs would be available from March 2016, and I realised quite suddenly that we had the tools to easily get rid of Hep C now. I've worked with viruses my whole life and in public health, and I realised if we could drop the amount of infections very quickly, the amount of new infections would go down to almost nothing. But it meant ramping up treatment rapidly and reaching as many people as possible and not leaving people behind.
In Cairns, we were also really keen to have multiple access points for people for treatment. That could have been through the hospital liver clinic or sexual health when people were in and out of corrections or at their homelessness service. So this was a really key element of connecting people into care by having multiple points and multiple services. In Cairns, we're small, no one service can do it all. We need really good communication and connection.
A box of those, please, and a box of butterflies.
No worries.
The way Hep C conversations emerge is pretty simple, really. I just ask people straight up, have they been tested for Hep C lately, and when was that? If they're on the treatment, ask how they're going with it. Like, how do you feel? So if someone's worried about that they might have Hep C, we've got such an amazing relationship with sexual health. I mean, they just work for us, like as a service, and for the people that come in here. I've got Carla and Rhonda there on dial. If they have trouble getting there, if they have trouble paying for the treatment, anything, whatever it is, we can sort it out.
The Aboriginal health workers are vital. They speak the language of their people. They know the problems, they know the families. So they work intimately with that group.
We're not just looking at the health issue, we're looking at holistic. We're looking at everything. You know, a lot of people, their next feed comes before their health, you know. So we gotta, sit down and yarn with them about why we're doing this sort of stuff, not just come along, oh, we need to do this. Sharing of that culture within the team is very important. And not only, within the Indigenous guys, but within the rest of the team, within sexual health, our guys educate the rest of the team.
Cairns Hepatitis Action Team started more than a decade ago, and it was people who had actually, some of them had been through hepatitis support groups. Most had been through treatment at the time, but not everyone. Some were still awaiting the new DAAs.
Well, when Carla gave me, promoted me from being a TAT member to being a peer expert and getting paid for my work, I gained a lot of self-esteem. That gave me a real ego boost because I was coming back from suffering a lot of shame from my Hep C over the years, and all of a sudden I'm an expert on the topic, that's a different perspective.
And that lady that was introduced me through my friend, her name's Kathy, and she's become a close friend since our first meeting. We're personal friends. Without her, I'd still be trying to get onto the treatment, but she made everything so easy for me, picked me up, took me to the appointments, took me for the blood test, followed it right through till I even organised to have the medication dished out with my morning methadone. So it was served to me on a silver platter. How could you not say yes to that?
Kathy does heaps to support people. I actually did a harm reduction course with Kathy, and we got trained in how to use a naloxone pen, and got a little card we can carry in our wallet to say that we are trained to use it. I actually had someone overdose on fentanyl at my house. I actually had to use all 5 goes, but it helped until the ambulance got there. That saved his life. And Kathy does so much to help so many people.
Pre-DAAs, the treatment was really quite horrible, and most people were looking at about a year's treatment, injections weekly that would knock them about so badly they might not be able to get out of bed or go and do their food shopping.
It was probably in the late 90s that I think I found out I had Hep C. Didn't want to go through the interferon program because I didn't want to get even sicker than I already was. So I waited until the tablets program came out. I got treated at Sexual Health. I went and saw them, and well, I called them first, and they said, yeah, come in. So I went in and I had a blood test done, and they said, yes, we've got just enough blood to get an analysis done for you, and we've found out your genotype, and we're going to treat you accordingly, and took the tablets as I was supposed to. And then I was back to be retested, and it come back clear.
I find those consults actually quite emotional. I mean, not only for the client, but also for me. And then particularly when you got to deliver the cured result, that was really quite joyous.
There's often financial barriers. Like, even though Cairns is a small town, it's quite dispersed. It can cost people a lot of money just in transport and time to get to our service. So we try wherever possible to give people $20 to kind of help cover those kind of costs and expenses. Sometimes it's sitting and listening to people. By the time people came to us, they were often really upset and sometimes really angry, and they'd had a real journey to get to us, and they just needed to sit and have a cry and be listened to by someone who really believed them.
Oh, being Hep C free is a great thing for me because it allows me to interact with my grandchildren without any worries. Hep C free is a great way to be. It's so easy. It's so easy to be Hep C free now, and you don't have to get sick to do it.